I'm Dr. Kirnesh Pandey, consultant diabetologist, and today we are going to discuss a case study wherein we are going to talk about the concept of intensification of treatment of diabetes. As we all know that diabetes is a progressive disease, and the objective of management of diabetes is to keep on intensifying the treatment so as to maintain euglycemia. So my patient, Mr. AB, is about 45 years. He's working in a corporate sector, and his diagnosis of diabetes is just relatively recent. He has been diagnosed as having type 2 diabetes about 6 months back. And at that point of time, he was started on metformin, which was started as a small dose and then gradually up titrated to about 1 gram BD. He also has concurrently comorbidities like hypertension and dyslipidemia, for which he is taking AC inhibitors and statins. If we talk about the data, other relevant information with respect to my patient, his BMI is around 31, so he's definitely overweight. And he has a family history of coronary artery disease on the maternal side and diabetic kidney disease on the paternal side. So after 6 months of taking metformin, he comes back to us for consultation. And the current information is this, that his currently fasting glucose is about 180. Post-meal is usually in the range of 230 to 40. HbA1c is 8.5 and is already on the background therapy of metformin 2 gram per day. Now, how do you go about managing such a case? This is the usual prototype case. Recent onset of diabetes, metformin is unable to attain the glycemic target. In a younger patient, relatively younger patient like Mr. AB, who has a background of family history of cardiac disease, renal disease, himself being hypertensive and has dyslipidemia, and metformin is unable to achieve HbA1c or target HbA1c in such a case should be below 6.5 or at least below 7. So this gentleman straight away has HbA1c which is more than 1.5% of whatever we are expecting his HbA1c to be. So definitely the first thing is we want to target his HbA1c below 6.5 or at least below 7. What are the pressing needs? Because this gentleman is working in the corporate sector, his eating patterns may be erratic. He might be in his meetings, therefore many a times it might be extremely difficult for him to stick to a regimen of diet. So he doesn't want a therapy which is very complex. He doesn't want a therapy which causes hypoglycemia in him. As we realize that he is overweight, so we want to do something to reduce his weight. And what is the ultimate objective? The ultimate objective is that we want to prevent coronary artery disease and kidney disease in such a case. So there are many options now how to go about intensifying the therapy. But today we are discussing about why not intensify the therapy with a combo of empagliflozin and linagliptin. So metformin is already going on the background, just one tablet, 5 mg of lina and 25 mg of empa, which comes as a fixed drug combination can be added. This option has certain advantages. There is additional burden of only one pill. There is no hypoglycemia. The combination is weight neutral or weight reducing. And there is robust data to suggest that this combination is not only cardiovascular safe, but also renoprotective and has benefits in terms of reducing hospitalization due to heart failure. As we all know, that linagliptin is a DPP-4 inhibitor. So it suppresses glucagon, increases intrinsic GLP. Insulin will get released from the beta cell, but in a glucose-dependent fashion, so no hypoglycemia. Empagliflozin, we all know, is SGLT2 inhibitor. There will be glucosuria. And when both are given together, the chances of mycotic fungal infection also come down. So naturally, in a case where intensification is concerned or intensification is the issue, this combination of EMPA plus LINA can be a handy combination in such a category of patient, because now this patient will be on LINA plus EMPA. On the background, there is metformin. So you are acting upon number of pathophysiological defects. You are causing his blood sugar to come down. You might cause your patient to lose some weight, which is desirable. And this combination has a robust data as far as prevention of cardiovascular renal disease is concerned. So the concept or the message is that intensification with a combination therapy should be considered in the current age of practice so as to attain good glycemic control without unnecessary hypoglycemia and without weight gain. Thank you so much.